Hello and welcome to another episode of Pop Health Hub, where we discuss all things population health management. I'm Bob Canals, Administrator of Business Development here at Populitics, and I'm joined in the studio with Zach Jones, Senior Sales Executive, Populitics Health Management Solutions. Welcome to the studio.
Thanks for having me, Bob.
And this direct contracting is not new. I've been reading about this for years with the larger companies like Walmart, and Amazon, and Lowe's, and all of those, where they've gone out and contracted directly with local health systems. You and I have talked about the Oklahoma Surgery Center.
Yeah.
So where do you see sort of the next evolution with this sort of evolution of health systems away from fee-for-service, more value-based, more outcomes-based, but also providing employers more control by contracting directly?
Well, I think the big thing is I think the next iteration is that you're going to see more health systems, if they're innovative enough, to go out there and really just partner directly with these employer groups and say, hey, we want your business, right? We know, for every 1,000 people that are on a health plan, you're going to probably have one heart attack a year.
Right.
It's just the numbers. And so we want to take care of that patient, right? We want to have the services in place to take care of it, and we'll compete for the business, right? On a kind of a true supply and demand, or true capitalistic type society, the way everybody else competes. And so you're going to start seeing a lot more of these, kind of bundled arrangements where, you have a bundled price for certain services that's very transparent. And as an employer, you can see that, right? And then you can incentivize your employees to be able to go to these different facilities that have a better cost and a better quality outcome, because you're going to be able to in turn save money. And so that's really what I think is kind of the next step. I think the other thing you have to look at is just consolidation of like hospital and health systems over the last decade, right?
It's going to continue to happen.
It's going to continue to happen. And so if you look at a hospital system, they want to put themselves in a position to be able to continue to get market share and grow, and direct services into their facilities over their competitors. And so the only real way to do that is to begin to differentiate yourself. And so you need to really start to look at some of these outside of the box type solutions. I've had experience in the past, many places doing some of these direct contracts, and they can work pretty well, right? You get the employer at the table, you get a big entity or a big conglomerate of employers at the table, and you can negotiate a fair deal for really everybody. And it's amazing how much, when you get direct to the point, it's amazing how much money can be saved for that employer. And it goes downstream, right? The employees tend to like that. I think the other thing too is that you kind of have this notion where you don't want to force people to go to that facility, but what you do is you kind of have a carrot. You say, hey, look, we know the quality's really good there, right? We know the cost is less expensive than some of the other providers that we have, access to. And so we'll give you that carrot, right, by waiving that deductible. You can still go to the other facility if you'd like, but we're going to have to ask you to participate in the cost share, because we know that the quality is not as good and the cost is much more expensive.
It's amazing what you're bringing up here, was how that financial component is really a big driver. I think about cases like Walmart, where Walmart has a Centers of Excellence program embedded into their health plan, where for knee surgery you can go to this list of health systems throughout the country. They'll pay for you to go there. They'll pay for your travel. It costs you nothing to go there. You do have a choice in that plan, right? So if you decide not to go there, you can go anywhere you want. Now you're subject to your $5,000, $6,000, $7,000 deductible out of pocket. You'd be surprised. I think at the end of the day, sort of this notion that we've all been used to, which is offer more choices, as many as you can, just a plethora of choices. That's what people want, especially as it relates to healthcare and how complex it can become. That's not what employees want. They want guided choices. They want quality choices, but they don't want so many choices where they feel like they can't choose anything.
Yeah, no, I think that's the truth. Everybody's in a situation where a $5,000, $6,000, $7,000 deductible scares them, right? And the last thing you want as an employer is somebody prolonging getting their knee done,
right?
Because it just starts to have a ripple effect in the health of that employee, right? It's harder for them to get up and down steps.
Yeah.
They can't work as fast. They're in pain. And so when you add up all those things, a lot of it is because they're prolonging the care because the
Yeah.
financial situation is really dire.
Yeah.
And so the only way to pay less for health insurance premiums is to pay less for health care,
Yeah.
right? And so there needs to be this level of transparency where you start to see that, hey, the quality, right, does actually result in a less expensive
Yeah.
cost of care. And I think any physician or any health system would tell you that. They're like, it doesn't cost us as much to do this knee surgery because of the quality of physician that we have performing the operation, because he's just not in the operating room as long as the other guy.
Yeah.
He just does them a lot more often.
Right.
So
Yeah. Really good stuff.